Chapter 7: Understanding Medicare Costs. It is crucial you have an understanding of the out-of-pocket expenses that are associated with Medicare. Out-of-pocket costs can be found with original Medicare Parts A and B, through deductibles and coinsurance, through Part D prescription drug plans, and many Medicare supplement plans. Medicare Part A. Medicare expenses for Part A. Inpatient hospital deductible, $1,600. Inpatient hospital coinsurance. After you have paid your deductible, Medicare pays 100% of costs for your first 60 days in the hospital. After that, your out-of-pocket costs are $400 per day for days 61 through 90, and $800 per day for days 91 and later while using 60 lifetime reserve days. There is no coverage under Medicare Part A for more than 60 days as a hospital inpatient. Skilled nursing facility coinsurance, $0 copayment for days 1 to 20. You pay $200 per day for days 21 through 100. You pay all costs after day 100. Home health care. You pay $0 for covered home health care services. You pay 20% of the Medicare-approved amount for durable medical equipment, like wheelchairs, walkers, hospital beds, and other equipment. Hospice care. You may need to pay a copayment of no more than $5 for each prescription drug and other similar products for pain relief and symptom control while you're at home. You may need to pay 5% of the Medicare-approved amount for inpatient respite care. $0 for covered hospice care services. Medicare Part B. The Medicare Part B premium is $164.90 in 2023, or higher depending on your income. The amount can change each year. You'll pay the premium each month, even if you don't get any Part B covered services. There are also state Medicaid programs that allow low-income beneficiaries to not pay anything at all for Medicare Part B. Some late enrollees may pay a penalty in the form of a higher premium, and high-income individuals may pay more as well. Cost sharing under Medicare Part B. Annual deductible. You pay $226 before Medicare Part B benefits begin. Physician coinsurance. You pay 20% of the Medicare-approved amount. You may pay more if your doctor does not accept Medicare. Preventive care services. Certain preventive care is covered 100% by Medicare. Services that do not fall under this category follow the physician coinsurance provisions above. Outpatient hospital care. Usually 20% of the Medicare-approved amount for doctor and other health care providers' services. You'll also pay a copayment to the hospital for each service you get in a hospital outpatient setting, except for certain preventive services. In most cases, your copayment won't be more than the part a hospital stay deductible amount. Lab tests. You pay $0 for covered clinical laboratory services. Medical equipment and supplies. Medicare pays up to 80% of the approved amount. You pay the rest. Note that the Medicare-approved amount can be less than the actual charge, so you could pay more than 20% of the total cost. Outpatient mental health services. You pay 20% of the Medicare-approved amount. Medicare Advantage. Medicare Part C, also called Medicare Advantage, plans are sold by private insurance companies. Because of this, coverage details and pricing, such as premiums and other cost-sharing provisions, can vary by plan. This is why it is recommended that you compare all plans in your area when looking at Part C options. Our plan comparison tool can help you view a list of Medicare Advantage plans in your area. You may also study the plan documents, which you can get from the specific insurance company offering the plan, and compare them with what is covered and how much you would pay out of pocket against Medicare Parts A and B and/or D for the typical healthcare expenses that you expect to experience in a given year. Some Part C plans may have a $0 monthly premium, although this does not necessarily make them the cheapest option. There could be higher copayment or coinsurance amounts to balance out the $0 premium. Also, even if you choose to join a Medicare Advantage plan, you must continue paying your Part B premium. Medicare Advantage plans may have network restrictions that require you to go to doctors and hospitals that participate in the plan's health care provider network in order to be covered. Other plans allow you the freedom to go anywhere for services to be covered. Still, others might cover services at different levels depending on whether you went to a network doctor or if you went outside the network. All Medicare costs and rules are outlined in the documentation you will get from the insurance company. Medicare prescription drug plans. Your cost will vary by plan. You may have to pay more, depending on your income. Medicare. So it pays to shop for the plan that fits your specific needs. Supplement plans. There are a good number of plans to choose from when considering Medicare supplements, Medigap. Some of the plans offer richer benefits with minimal out-of-pocket costs. Others have more costs needing to be covered by the enrollee before the plan begins to pay. You can review the plan benefits and out-of-pocket costs by visiting Medicare.gov or by speaking with your Medicare insurance agent. Thanks for watching.